Let's talk about something that's probably crossed your mind while scrolling through social media or catching someone's bright smile. Teeth whitening. It's everywhere. The market is absolutely flooded with products promising a Hollywood smile in days, sometimes even hours. Whitening strips, LED kits, charcoal toothpaste, pens, trays, you name it. And then there's professional whitening at the dentist, which costs significantly more but claims to deliver superior results. So here's the real question: which one actually works? And more importantly, which one is right for you? Before we compare options, let's understand what causes teeth to become discolored in the first place. Your teeth have pores similar to your skin. Over time, these pores absorb stains from the foods and drinks you consume. Coffee, tea, red wine, berries, soy sauce, these are all major culprits. Smoking is another significant factor. Then there's the natural aging process. As you get older, the outer layer of enamel gets thinner and the yellowish dentin underneath starts to show through more prominently. There are also internal factors to consider. Certain medications, especially tetracycline antibiotics taken during childhood, can cause deep staining. Too much fluoride during tooth development can lead to fluorosis, which creates white spots or streaks on teeth. Even trauma to a tooth can cause it to darken over time. Understanding the type of discoloration you have is crucial because it determines how well whitening treatments will work. Surface stains, also called extrinsic stains, respond really well to whitening. But intrinsic stains, the ones deep within the tooth structure, are much more challenging to treat and may not respond to whitening at all. Now, let's break down how teeth whitening actually works. Whether you're using an at-home kit or sitting in a dentist chair, the basic chemistry is the same. Whitening products contain peroxide, either hydrogen peroxide or carbamide peroxide. When these compounds break down, they release oxygen molecules that penetrate your tooth enamel and break apart the stain molecules. This process is called oxidation. The stains get broken into smaller pieces, which makes them less concentrated and less visible. Your teeth don't actually become white, they just become lighter versions of their natural color. The key difference between at-home and professional treatments comes down to three things: concentration, application method, and supervision. At-home options are convenient and affordable. Let's start with the most popular whitening strips. These thin, flexible plastic strips are coated with a whitening gel that typically contains around 6 to 10% hydrogen peroxide. You apply them to your teeth for 20 to 30 minutes, usually once or twice a day for a couple of weeks. The advantage here is obvious: convenience and cost. A box of strips might run you $30 to $60. You can do it while watching TV, working from home, or getting ready in the morning, and they do work, at least to a degree. Most people see results after a few days, with full results visible after 2 weeks. Studies show that whitening strips can lighten teeth by 1 to 2 shades. But there are limitations. The strips are designed to fit the average person's teeth, which means they might not conform perfectly to your specific tooth shape and alignment. If you have crooked teeth or gaps, some areas might not get covered properly, leading to uneven whitening. The peroxide concentration is relatively low, so while it's safer for unsupervised use, it also means the results are more modest and take longer to achieve. Then there are whitening trays with gel. You can buy generic one-size-fits-all trays, or you can get custom trays made by your dentist to use at home. The generic ones have the same issue as strips: fit. If the tray doesn't fit snugly, the gel can leak out onto your gums, causing irritation. Custom trays solve this problem and typically deliver better, more even results. The concentration of peroxide in at-home tray systems usually ranges from 10 to 20% for carbamide peroxide. You wear these trays for anywhere from 30 minutes to several hours, depending on the product. Some are even designed to be worn overnight. Treatment duration typically spans 1 to 2 weeks. Custom tray systems are more effective than strips, but they're also more expensive, often costing between $100 and $400 if you get them through your dentist. Still, that's considerably less than in-office professional whitening. LED whitening kits have become hugely popular in recent years. These kits combine a whitening gel with an LED light device that you hold against your teeth. The claim is that the light accelerates the whitening process. Here's the thing though, The scientific evidence on LED lights is mixed at best. Some studies suggest they might provide a marginal boost, but many dental professionals argue that the peroxide is doing all the heavy lifting, and the light is mostly a gimmick that makes the product feel more high-tech. Now let's talk about some of the trendier options. Charcoal toothpaste has exploded in popularity, with influencers and brands claiming it naturally whitens teeth. The idea is that activated charcoal is highly absorbent and can pull stains off your teeth. The reality is more complicated. While charcoal is abrasive and might remove some surface stains through physical scrubbing, it doesn't actually whiten teeth the way peroxide does. And the abrasiveness is actually a concern because it can wear down your enamel over time. Whitening toothpastes in general are worth mentioning. The ones you find in stores contain mild abrasives and sometimes small amounts of peroxide. They can help remove surface stains and prevent new ones from forming, but they won't dramatically change the color of your teeth. Think of them as maintenance products rather than transformation products. Whitening pens are another option, portable and convenient for touch-ups, but the gel doesn't stay on your teeth very long, which limits their effectiveness. Now, professional whitening. When you go to a dentist for teeth whitening, you're getting a significantly more concentrated treatment. Professional in-office whitening uses hydrogen peroxide gels with concentrations ranging from 25 to 40%. That's 2 to 4 times stronger than what you'd find in over-the-counter products. The procedure typically takes about an hour to 90 minutes. Your dentist will start by protecting your gums with a barrier or special gel because the high concentration of peroxide can cause chemical burns if it contacts soft tissue. Then they apply the whitening gel to your teeth. Many dentists use a specialized light or laser to activate the gel, though as I mentioned earlier, the jury's still out on how much the light actually contributes to the results. The gel is usually applied in several 15 to 20-minute intervals, with fresh applications between each interval. By the end of the session, most people see their teeth lighten by 3 to 8 shades. The results are immediate and dramatic, which is one of the biggest selling points. The cost reflects this intensity. In-office professional whitening typically runs between $500 and $1,000, sometimes more depending on where you live and which dentist you visit. That's a significant investment, but you're paying for several things: the stronger formula, the expertise and supervision of a dental professional, the time savings, and typically more dramatic results. There's also a hybrid option worth mentioning. Some dentists offer take-home professional kits. This is where you get custom-fitted trays and professional-grade whitening gel from your dentist, but you apply it yourself at home over the course of 1 to 2 weeks. The peroxide concentration is higher than store-bought products but lower than in-office treatments. This option costs less than in-office whitening, typically between $200 and $600, and delivers results somewhere between over-the-counter products and professional treatments. So which works better? Both work, but differently. Professional whitening delivers faster, more dramatic results perfect for events or significant staining. At-home whitening works gradually over weeks and is budget-friendly for mild to moderate stains. Important considerations. Sensitivity is common with both methods. Professional treatments cause more sensitivity due to higher concentrations, but dentists can apply desensitizing agents. At-home products include some desensitizers, but you manage discomfort yourself. Not everyone is a good candidate. If you have decay, gum disease, or severe sensitivity, address those first. Whitening doesn't work on crowns, veneers, or fillings, which could create color mismatches. Severe internal staining may not respond well. Both options are temporary. Professional whitening lasts 1 to 3 years. At-home methods about 6 to 12 months, especially if you drink coffee or smoke. Whitening toothpaste and touch-ups help maintain results. Set realistic expectations. Natural teeth aren't perfectly white, and whitening doesn't fix dental issues. A dentist should always check your teeth first. For light stains and a smaller budget, at-home whitening works well. Strips are easy, custom trays are stronger. For fast, dramatic results or heavy staining, professional whitening is worth it. The ideal combo: get professional whitening first, then maintain with at-home touch-ups and whitening toothpaste. Both methods work. The best choice depends on your budget, timeline, and tooth condition.